I practice acupuncture and Chinese medicine and counseling in Eugene, Oregon. And I use this laser extensively with myself, as Arjan said, and that's another story completely. Today I'm talking about this case, a patient with eye pain and tension using the 905 delta laser. This woman had a long history of left eye pain and tension with a pulling sensation on her eye and a frozen feeling. One of the things that she talks about is that it feels like it makes her eyes not track together. Her left eye wants to pull to the left. And the pain that she feels is in her temple area and above her eyes, and it's about a 3 to 4 on a 0 to 10 scale. Also, she notices that this tension is a lot worse when she's anxious or angry. The problem with the eye and the frozen feeling is much worse when she's emotional. In addition, she has a lot of sinus congestion due to spring pollen allergies, and that's actually the main reason why she comes in for acupuncture. I treated her 4 times in the office once per week with the 905 delta. The first treatment I did acupuncture only. So I treated her for the allergies and emotional, and I put some needles in around the left eye. The pain level was 3 to 4. In the second treatment, I treated her with both the delta laser and acupuncture. After the first treatment, she said that her left eye was still tense, so it didn't make a huge difference. After the second treatment, I used acupuncture and the laser, and she said that the tightness diminished and the frozen feeling was gone, and her sinus pressure had eased, but then it came back. I treated her with the laser with points right around the eye and in the temple, maybe a little bit above the eye there. And also we did some, as close as I could get, with underneath like so. Okay, so those are the points mainly that we did. I also did the universal head treatment with her. After the third treatment, so I did the universal head, and then I would do that local area. And we used acupuncture. We used acupuncture mostly for the sinus, but then I would sometimes do the laser and then put a couple of needles in where I couldn't get. I would put a needle here and a needle in a point right in front of her eye, like that, after the laser treatment. Okay, so after the third treatment, she said that the pain and the tightness were further reduced. She just uses interchangeably this word tightness and pain, that the frozen feeling was completely gone, and that this tension pain level was now a 1 to 2, and that oftentimes she doesn't notice it at all. Okay, now the fourth treatment, we did the acupuncture and the laser again. And so at the end, she says there's a definite improvement in the tension and pain and the openness in her left eye, because her left eye usually looks a bit smaller than her right eye. I felt like the acupuncture and the delta worked really well for her. I'm giving the laser like 3/4 of the credit for the improvement in the eye pain. The patient's very happy. She feels like the treatment's really helping her. Her sinus congestion is also improving. I'm still continuing to treat her weekly, and I'll see what other improvement we can do, because I see her weekly anyway for the sinus. That's it.